Welcome to RxPlay. In this video, we'll discuss what is insomnia and how to treat chronic insomnia. So what is insomnia? Insomnia is the most common sleep condition affecting millions of people across the globe each day. Insomnia is characterized by two features. The first one being unable to fall asleep and the second, stay asleep. That is, the sleep quality overall is compromised. A person is said to be having chronic insomnia if these symptoms happen for at least 3 times per week for at least 3 months, despite a good environment for sleep. This chronic insomnia impacts both the job as well as daily routine of a patient, and as a result there is poor quality of life. Treatment of chronic insomnia can be achieved by non-drug therapy or drug therapy. Non-drug therapy involves CBT, which means cognitive behavioral therapy. Cognitive behavioral therapy involves taking measures such as keeping bedroom dark, comfortable and quiet, having a regular sleep cycle, avoiding daily time naps, and caffeine in the afternoon, and many more. Moreover, before going to drug therapy, it is important to identify as well as address any underlying conditions which can cause insomnia. For example, shortness of breath, pain, depression, and drugs which the patient is already taking. Current medications which can worsen insomnia include steroids, antipsychotics like aripiprazole, bupropion, and stimulants like alcohol and many more. If the non-drug therapy options are exhausted and patient is still suffering from insomnia, then we need to move towards drug therapy. Drug therapy include two options. The first one being natural products, followed by approved drugs. Natural products include, but not limited to, chamomile tea. A cup of chamomile tea in evening is said to have a calming and relaxing effect on brain. Chamomile tea contains a substance known as apigenin, which binds to GABA receptors. GABA stands for GABA aminobutyric acid, which is a neurotransmitter and basically inhibitory neurotransmitter, and causes central nervous system sedation or depression. Similarly, a lavender aromatherapy has the same effect as chamomile tea, which is used for the management of chronic insomnia. Moreover, valerian root extract pills are present in pharmacies and they contain a substance known as valerianic acid. This valerianic acid decreases the breakdown of GABA, thus enhancing its effect. Its usual dose is 400 to 900 mg per day. Valerian root extract pills are usually safe, however, there are reports of liver toxicity and care should be taken in taking these medications if there is a liver problem, such as hepatitis. Melatonin is another substance which is used for the management of chronic insomnia. Melatonin is a natural hormone present in body and binds to melatonin type 1 receptor in brain. Its usual dose is 0.5 to 3 mg per day and they help regulate the circadian rhythm. Melatonin is of particular importance for frequent flyers and it is used in jet lag. If natural products and cognitive behavioral therapy does not produce any effect, then there is a need for approved drugs. Approved drugs can be broadly classified into antihistamines, non-benzodiazepines, orexin antagonists, melatonin agonists, tricyclic antidepressants, and benzodiazepines. Among these classes of drugs, antihistamines are the most widely used drugs, and the reason is they are available over the counter. Patients self-treat insomnia with the first generation antihistamine drugs, such as diphenhydramine and doxylamine. These drugs block H1 receptors, histamine type 1 receptors, and mainly used for allergy. However, blocking H1 receptors in brain can cause sedation. And when these drugs block H1 receptor, there is decrease in secretion. As a result, Dry mouth and urinary retention are its side effects. These drugs should not be used in patients particularly suffering from benign prostate hyperplasia and glaucoma, because in glaucoma it can increase the intraocular pressure, and in benign prostate hyperplasia it can cause problem in urination. Drugs belong to this class are diphenhydramine and doxylamine. Its usual dose are 50 mg per oral at bedtime, QHS stands for at bedtime, and 25 mg respectively. If you look at the structure of these drugs, you can see that it contains a large nonpolar region. As a result, it can easily cross blood-brain barrier and can target H1 receptors. Besides antihistamines, patients self-treat themselves with a number of cough suppressant drugs and cough suppressant syrups, which contains these agents as well as dextromethorphan and ammonium chloride. American Academy of Sleep Medicine does not recommend and actually inhibit or contraindicate the use of these agents for the management of chronic insomnia. Non-benzodiazepines are another class of drugs which is used in the management of insomnia, and they are preferred in first-line treatment over benzodiazepine. The reason is there is decreased risk of physical dependence in case of use of non-benzodiazepine, as well as fewer daytime cognitive effects. These drugs produce its action by selectively binding to the benzodiazepine receptors, thus increasing the level of GABA, and which causes CNS depression. These drugs have side effects, that is ataxia, which is imbalance in the coordination. And drugs which belongs to non-benzodiazepines are isoprolol, zolpidem, and zaleplon. Their usual doses are 1 to 3 mg, 5 to 10 mg, and 1 to 3 mg respectively. Zolpidem also comes in sublingual form as well as spray form. The most important thing when prescribing or using these medications is to start with the lowest possible dose for the shortest duration. And if the desired results are not achieved, it can be slowly titrated and moved upwards. For example, patients should be first put on zolpidem 5 mg and then titrated towards 10 mg. And as soon as insomnia is cured, or cognitive behavioral therapy along with these drugs cause a significant decrease in problems associated with insomnia, these drugs should be stopped. Orexin antagonists are another class of drugs which are used in the management of insomnia, and these drugs actually block orexin neuropeptide signaling system. The natural function of orexin or physiological function of orexin neuropeptide signaling system is to promote wakefulness. By blocking the wakefulness, it causes sedation. Most of them usually require 1 to 2 hours to cause its effect. Somnolence is the major side effect of these class of drugs, and somnolence means prolonged sedation, which is carried out even until the next day. Drugs such as limborexant, suvorexant, and daridorexant belongs to orexin receptor antagonist. Their usual doses are 5 to 10 mg, 10 to 20 mg, and 25 to 50 mg per oral. Melatonin agonists are another class of drugs, and they bind to melatonin type 1 and type 2 receptors which are present in brain. By binding to these receptors, they promote sleepiness and regulate circadian rhythm by coordinating the sleep-wake cycle. Somnolence is the major side effect of these drugs as well. It is important that these drugs should not be used with antidepressants such as fluvoxamine. Fluvoxamine increases the concentration of drugs belonging to melatonin agonists such as ramelteon and can cause severe sleepiness. Ramelteon and tesimelteon, drugs which are belonging to these melatonin agonists. Their usual doses are 8 mg and 20 mg respectively. Tricyclic also comes in oral suspension, and they are the only drugs which can be used in younger patients as young as age of 3 years if there is non-24-hour sleep-wake disorder. Tricyclic antidepressants, as the name indicates, contain three different rings in their structure. In fact, three rings, three cycles. That's why they are called tricyclic antidepressants. These drugs inhibit the non-epinephrine and 5-hydroxytryptamine reuptake. Moreover, they also block acetylcholine and histamine receptors. By blocking these, they further contribute towards the dizziness or somnolence. They are contraindicated with monoamine oxidase inhibitors. Usually, monoamine oxidase inhibitors and tricyclic antidepressant should be taken at least 14 days apart, that is 2 weeks. Doxepin is the only FDA-approved drug which is used for the management of insomnia. Its usual dose is 3 to 6 mg per oral at bedtime in adults. However, in geriatrics with age more than 65 years, its dose is 3 mg. Benzodiazepines, as the name indicates, it contains benzene which is fused to diazepine ring. Benzodiazepines increases the level of GABA and causing CNS depression. There is a problem with benzodiazepine, and that is risk of physical dependence. Therefore, they are not preferred. Dizziness and risk of fall are the major side effects of benzodiazepines. Temazepam, lorazepam, and oxazepam are drugs which belong to benzodiazepines, and these drugs are recommended in older patients because lorazepam, oxazepam, and temazepam, also known as LARD drugs, have shortest duration and thus fewer side effects, especially daytime cognitive effects. Their usual doses are 7.5 to 30, 2 to 4, and 10 to 30 mg per oral at bedtime. In summary, the treatment of insomnia should begin with non-drug treatment including CBT, that is cognitive behavioral therapy, and identifying and addressing the underlying conditions which cause insomnia. If they does not respond, it can be used in conjunction with natural products. From clinical perspective, if there is a need for drug treatment, then our objective should be following. The first one being having a quick sleep, the second one having sound or deep sleep, and the third and final one, both of these, that is quick and sound sleep. Drugs which belongs to quick sleep criteria are Melatonin, Zopiclone, Zolpidem, and Zaleplon, while in case of sound sleep or deep sleep, Doxepin, Zopiclone, Orexin, and Zolpidem are used. For both quick and sound sleep, Zopiclone and Zolpidems are drugs of choice. It depends on the patient need which drug should be used. However, generally speaking, Zolpidem and Zopiclone are better options. If you like this video and found it useful and helpful, then kindly subscribe to my channel as well as press the like button as well as the bell icon. Stay tuned for more videos and thank you for your time.